Good morning, everyone. I'm Anil Jain. I am the Chief Innovation Officer here at Innovaccer. It is so good to see so many familiar faces, although right now I can't see anything, and so many new ones. I know that last evening was a little bit cold, but we're going to warm you up with some of this product work that we've been doing. Now, the important thing to recognize is that if you see something as you see all our demonstrations that you like, please clap for our engineers and for our product folks. Now, when you think about product, and I think we heard a couple themes earlier from both Sandy and Abhinav, and then you heard it again from David and Robin. There's a massive set of challenges happening. And if we're going to build tomorrow's healthcare, I know tomorrow's healthcare is being rebuilt in DC, but we can only control what's happening here. We know that this shift that's happening between fee-for-service to VBC, it's a gradual shift. You got to sort of walk in both places at the same time. We also know that it's not only primary care, but there's a workforce shortage happening throughout the entire care team. And burnout is all too real. In fact, most of our colleagues that are in this room right now are probably not practicing full-time medicine if they are practicing. Show of hands, how many are still practicing medicine? How many clinicians in the room? Okay. All right. And I used to practice 100% and dwindle my practice down to 20% when I left the Cleveland Clinic. And now I'm doing health IT for Innovaccer for the past 3.5 years. I think the other thing that's happening is there's a lot of consumerism happening in healthcare. We all are demanding more out of our healthcare experiences, and so are your customers, your patients. They need to be more personalized and more engaged. And you'll hear a little bit more about that in a little bit. The other thing is that as we move from the volume to value and we try to empower our providers to take a more active role in their care and in the care they provide their patients, and we at the same time try to produce a more modern consumer experience, the kind of experience that we typically have in every other part of our lives, whether it's booking flights or whether it's figuring out what to watch on TV, there is a considerable difference between the way we experience healthcare, the way your customers experience healthcare, and the way that they're being asked to support that. And I think it's important for us to realize that what we have built over the last 10 years that Sandy and Abhinav have described, as lofty as it was and as incredible as it was, isn't going to get us to the next 10 years with all these shifts happening. It's important that if we're going to build tomorrow's healthcare together, that we do so with an eye on how we're going to solve these issues, one by one, but together in a common framework. So how do we think about that? Well, I want to invite one of my colleagues, Abhay Prasad, to help us understand a little bit more about what do those future building blocks look like when we are trying to build a modern healthcare platform for the modern way that healthcare needs to be delivered. And then you'll see me again in a few minutes. And Abhay, why don't you take over?
Thank you, Anil.
Sure.
Good morning, everyone. I'm Abhay Prasad, and I have the privilege of leading the product and design organization at Innovaccer. My background is in applied AI and digital customer transformation. And in the past, I've led teams at companies like Nuance and Meta. But what I really want to share with you is a story, not my experience as much as a story that's really important to my family. During one of the COVID waves, my brother was hospitalized and admitted into the ICU, and he spent more than 4.5 months there, and he lost a lung. I saw his care team, the nurses and physicians attending to him, go above and beyond anything I could have imagined or expected them to do, and they saved his life multiple times during that period. So I joined Innovaccer, humbled by the dedication his care team showed him. I'm happy to report he's doing well now. And I joined Innovaccer a few months ago, inspired by its mission to help healthcare organizations, all of you, deliver high-quality care at affordable cost to everybody. And I see my work and our work as part of giving back to the profession and to all of you who help keep us healthy and keep our families intact. Thank you. And so let's get to the problems that Robin and David and Anil mentioned, right? These are daunting challenges. You're being asked to do more with fewer resources in the face of margin pressures workforce that feels burnt out and challenged, and rising customer expectations. Now, the good news is, working with you, partnering with you over the last few years, Innovaccer has been laying the foundation of the building blocks that we believe will serve you well, not just in navigating these shifts, but actually thriving in the face of them. Let's see what these are. Well, a little bit late for that. All right, it all starts with the unified health record. Years ago, when Abhinav and Sandy and the team started working with you, the challenge you gave us was fragmented healthcare data that prevented you from acting on the most important up-to-date insights of a patient's life, right? So we worked with you over the years to solve that, and that is absolutely a core building block of any healthcare platform of the future that can even start to solve these challenges. But on top of that, you also need dashboards that provide your teams with the critical operational insights that they need to actually take action. But as we all know, action, and actually a therapist friend of mine told me once, insight is overrated unless it is acted upon, and I think she was right. And so you need workflows that can allow your teams to act on those insights rapidly. And then finally, going back to what Robin was talking about in terms of healthcare worker burnout, turnover, and shortages that we're all seeing, well, an essential part of solving these interlocking problems is going to be using AI to augment and supplement our team members to, going back to the New York kitchen story, to take something off their plates so that you can give them more time to work on what is actually important to the patient's life. If you put all this together, you get what we're calling our AI-first healthcare intelligence cloud. At the very base of it, at the very foundation, you have the data activation platform that I know many of you know really well, and we have infused it with healthcare contextualized Sarah AI, an AI layer that infuses all our solutions. And the solutions we're working on address those three key shifts: value-based care and the growing need to deliver on risk-bearing arrangements. The second is provider productivity, and we're defining this broadly to cover all healthcare personas, and how do we make them more effective and efficient and take some tasks off their plates. And thirdly, healthcare experience, which is how do we deliver the kinds of delightful experiences we all experience in other aspects of our life as consumers? How do we make the experience for our patients when they reach out for care more similar to that? Let's start. I'll spend a few minutes on telling you about sharing our vision about each of those four components. One is, let's start with the data platform. Our vision around the data platform is going to be driven across three themes that we believe will transform the way data is harnessed and activated in your organizations. The first is trust. We're building unprecedented levels of data quality, security, and compliance into our platform so that at every point, your teams feel confident they are working with accurate data that comes from validated and verified sources. We are also committed to delivering on an open and interoperable platform so that you can combine data coming from multiple different sources as well as systems. We are going to make sure that the data that you need flows across all the solutions your teams work on seamlessly. And you'll see examples of how this actually really makes the workflows across solutions like risk, quality, care, pop health analytics very powerful. And finally, real-time actionability. We're working to capture and activate data at the moment that it's created so that your teams can respond in real time and to make changes or respond to changes as they happen. Our vision for value-based care is to support all your teams across every stage of the VBC lifecycle, from design to execution to optimization and settlement. You'll see a lot more about this from Jim, who's going to come on right after this. But in terms of, many of you are very familiar with our solutions around risk, quality, care, referral management, but we're investing heavily in new areas like whole person risk stratification, as well as building end-to-end solutions from analytics to AI agents that help your teams perform these tasks. We also know, working with you, that in order to create effective, profitable, value-based care arrangements, actuarial insights are really critical to you. And so today, I'm happy to announce that one of the leading providers of actuarial insights and analytics, Humby AI, is part of the Innovaccer family. Humby's capabilities are available for all of you to use today, and they are being integrated into our products to make them even more powerful for your teams. Our vision for productivity is to help your teams drive superhuman results by supplementing and augmenting them with AI copilots and AI agents. AI copilots work alongside your team members, and you'll see great demos around this. They work alongside your team members and provide real-time assistance to them as the work happens on a daily basis. AI agents take away low-value, high-friction tasks from your team members and do them in an automated way, but always with human supervision. So these are tasks like playing phone tag with a customer or a patient to schedule an appointment, or checking prior auth status multiple times a day. Taking these tasks away means your teams will be able to perform at the top of their license every day. We announced a few copilots early last year. I think some of you are already using them. For example, our care management copilot, our access center copilot. We're seeing really good early results. For example, one of our customers is seeing a 20% higher productivity for their care team and an equivalent increase in care protocol closure rate from using a care manager copilot alongside their team members. Today, we're announcing two really exciting copilots, the provider copilot and a referral management copilot. And as soon as I get off the stage, you're going to see a demo of those. So I'll continue moving on. But our vision is to build a copilot for every key healthcare user persona that we serve. And so you'll see a slew of them rolling out in the coming months. Let me introduce now the latest members of our team, and hopefully the newest members of your team, the Innovaccer's AI agents of care. Today we're launching 8 of these. You'll see one of them, the scheduling AI agent, in action today in this session. But if you come by our innovation showcase booths, you'll be able to see all of them. And we're really excited to help augment, to solve that labor shortage, to solve the problem of burnout that Robin and David were talking about. We believe these are going to be essential to coming to a solution around that problem. And finally, our vision around modernizing patient experience. You know, in our daily lives, we're used to really good consumer experiences, but when you get to healthcare, the experience tends to break down. And we believe that modern patient experience needs to have 3 critical elements. It needs to be intelligent, which means it should anticipate patient needs, and the system should, for example, be able to know when someone comes due for a colonoscopy or a mammogram, and reach out to them proactively on the channel of their choice at a time that is preferable for them. Second, it has to be personalized, which means we should understand and work with patients in a way that fits with their lives, right? And also keeps context of the interactions that have happened before. So that, you know how you call a call center and you go through the IVR and then you get to the agent and the agent asks you to repeat all that information? That shouldn't be happening. We all hate it, and there are ways very easily to make sure that that doesn't happen to you. So that's the kind of personalized interaction that we need to be able to deliver to our patients. And then finally, it has to be coordinated. We know that if you build a great interaction around outreach, and then if you force but you don't do the same with access, well, that's going to be a broken experience. And so we believe that in order to deliver the experience that your consumers and patients are expecting, it has to be full circle, from outreach to access, even to the point of intake when they're about to, at the point of care. So I'm going to leave you with just the guiding principles. And these are also our promises to you, our customers. The first is our top priority is going to be customer value creation. And that is going to be how we prioritize every key roadmap capability, as well as how we measure our success as a product team. Second, end-to-end solutions. We are going to solve your problems at every step of your workflow, not just give you point solutions, because we know that that only creates more process latency and more inefficiency for your teams. And third, AI at the core. We're going to be we are excited about the promise of AI, but not because it's cool technology, which it is, but because it has the promise to solve long-standing problems that you have had in a way that has not been possible before. And we're going to do this even as we remove human intervention from some tasks. We are going to make sure human supervision is always there, and that our AI solutions are serving you in a way that de-risks your operations from all the concerns you may have around hallucinations, et cetera. And that is our promise to you.